Episode 1 of The Pit is called 7 a.m., and the story centers around Dr. Michael Rabinavitch, also known as Dr. Robby, the head of the emergency department at Pittsburg Trauma Medical Hospital, or as he calls it, the Pit. It's a chaotic, underfunded, overworked hospital that sets the tone for everything that comes next. Robby's about to start a brutal 15-hour shift on the 4th anniversary of his mentor Dr. Adamson's death during the COVID-19 pandemic. This is Robby's first time working on this anniversary, and everyone, especially Dana Evans, the no-nonsense head nurse, is worried about how he'll hold up. But Robby insists he's fine. Spoiler, he's not. Before diving into the madness, Robby gathers his team. Dr. Jack Abbott, the night shift lead, dealing with some serious grief. We meet him standing on the hospital ledge, mourning a patient he lost. Dr. Frank Langdon, supremely egotistical but undeniably talented, he's been Robby's friend for years. Dr. Heather Collins, secretly pregnant, and based on her chat with Dana, it sounds like she's been through hell with infertility and miscarriages. Dr. Yolanda Garcia, blunt and sharp-tongued, especially with Langdon, though their friendship seems to thrive on mutual roasting. Dr. Cassie McKay, a second-year resident who started medical school late. She's 42 and working triage today. Dr. Samira Mohan, a third-year resident nicknamed Slow-Mo because she spends forever with her patients. And then we meet the interns, a mixed bag of personalities. Melissa King, sweet and enthusiastic, fresh from rotation at a veterans hospital. Trinity Santos, arrogant and loves to bully others, but clearly hiding some deep personal scars. Dennis Whitaker, a fourth-year med student from a Nebraska farm, well-meaning but shy. Victoria Javadi, a 20-year-old prodigy who's brilliant but faints during her first patient interaction. To make things worse, her mom is a top surgeon at the hospital. Robby also relies heavily on the nurses, like Princess, who speaks 6 languages, her best friend Perla, and Mateo, along with Kiera, the hospital social worker who takes on the emotional baggage of both doctors and patients. It's clear from the get-go that this hospital is a madhouse. Patients fill the hallways, and the chaos never lets up. The episode wastes no time introducing us to the cases that will define this shift. Case 1, a subway hero. Sam Wallace jumped onto the subway tracks to save a woman who was pushed. Unfortunately, he slipped on the way out, hitting his head on the rails. The team treats his head injury but has to wait and see if he wakes up. The rescued woman doesn't speak English, and it turns out she's Nepalese. The police confirm it was a hate crime. Her injuries are horrifying. Her ankle is not just dislocated but degloved, meaning the skin is stripped off down to the tendons. Langdon and Collins reset her ankle, but her recovery is going to be long and painful. Case 2, the triathlete. But first, if you're enjoying this recap, please remember to subscribe to our channel. That really helps us a lot. Case 2, the triathlete. Otis Williams comes to see Dr. McKay after experiencing shortness of breath during a run. Things escalate quickly when Otis suffers multiple cardiac arrests. The entire staff scrambles to save him, and Robby ultimately deduces that Otis's rigorous training has caused dangerously high potassium levels, leading to kidney failure and heart collapse. Robby acts quickly, starting a risky treatment before the labs even confirm his diagnosis, and it works. This case shows a lot about Robby. He's bold, very skilled, and willing to bend the rules to save lives. It also highlights Collins's strict adherence to protocol, and the tension between them hints at a past relationship. In between the big emergencies, we see Doug Driscoll, waiting with chest pain. A family dealing with their kid's accidental marijuana gummy ingestion, thanks to a careless dad. A guy casually giving himself an enema in bed. It's chaotic, messy, and exactly what you'd expect in an ER. Teresa comes in vomiting uncontrollably, accompanied by her 18-year-old son, David, who's glued to his phone. Dr. McKay senses something off about their dynamic and calls Robby in to take a closer look. When Robby gets Teresa alone, she drops a bombshell. She induced vomiting to get David to bring her to the hospital. The real problem is him. Teresa found a notebook where David listed female classmates he plans to kill. She insists he's a good kid grieving his father, who died of COVID-19, but she's terrified and desperate for help. Because David is legally an adult, they can't just commit him based on the notebook. Robby tries to handle the situation delicately, asking for Kiera's help, but David panics and runs. Robby chases him into the street but loses him. This case leaves a dark cloud over the episode, especially when Robby returns to the pit and has flashbacks to the pandemic, specifically the day his mentor Dr. Adamson died. And that's the chaotical start to the pit. Each episode will follow an hour at the Pittsburg Trauma Medical Center until they complete a full shift. I can't wait to see what happens next. Please remember to like this video and subscribe to our channel, and stay tuned for the next recap of another new wonderful show.